Okay, so once again we're hearing stories that parvo is back in the Bunbury region, and so I thought I'd just take a little bit of time to explain what we really need to be doing for your dog to stop this disease from spreading. Now, the first thing I really want to talk about today, and we're going to do this over a few days, is which vaccinations does your dog actually need? And this is based on the World Small Animal Vet Association guidelines that I'm going to talk about, because that's really our best evidence for what is required, or the evidence base has been looked at and they've come up with some guidelines. So basically, puppies should be receiving a vaccination at around 6 to 8 weeks, 10 to 12 weeks, and then again at around 14 to 16 weeks of age. And then after that, they need a booster at around 15 months of age. So they're really important, those courses, because puppies are certainly the age group which is most at risk of picking up parvo. Now, once they pass that 15-month age group and have that 15-month vaccination, they only need vaccinating against parvo, distemper and hepatitis every 3 years. There are still some vets that vaccinate annually, and certainly if your vet does that, it's worth having a chat with them to discuss why they feel that's necessary, because in some cases that may be recommended. But there is a lot of evidence now that says, look, every 3 years is going to provide perfect protection, and that's what I do for my own dog. I mean, my own dog, obviously, being a vet's dog, is at risk of being exposed to parvovirus on an occasional basis, but I'm still confident enough to vaccinate him every 3 years, and I'm happy he's going to be protected well. So those are really what we call the core vaccines. So the parvo, distemper and hepatitis are our core vaccines. The optional extra, or the non-core vaccine, is against canine cough. Now, times recommend that. I recommend that all puppies are vaccinated against canine cough, because really we should be socialising puppies and getting them out and about, meeting other dogs, and that's where they're at risk. So dogs that are at risk are really dogs that are going into kennels. That's why it used to be called kennel cough, but really we now call it canine cough, because we're seeing the bulk of these animals are actually picking it up outside of kennels. If they're going into grooming parlours, so the little fluffies that need a lot of grooming, it's worth protecting them, because we do see occasional outbreaks in grooming parlours. And also if your dog's just going to be out and about meeting other dogs socially, down the beach, places like that, we see a lot of cases coming from that sort of situation. So like I say, we recommend all puppies receive that, because they should be getting socialised young. Once they become adults, it really depends on their lifestyle factors. So for example, they're a farm dog, they never meet any other dogs, they never leave the farm, then they'd be at low risk of picking up canine cough, and so that really would be something that we'd consider not necessary for that individual dog. But really what you should be doing, chat to your vet, talk to your vet about your pet's circumstances, because what we should be doing is vaccinating every dog against what's appropriate, but only using the appropriate vaccine. So yeah, talk to your vet and work out a proper vaccination schedule for your pet.